Hello everyone, and I'm very excited to be with Dr. Venkatesh, who is our proud DBMCI student. Heartiest congratulations.
Thank you, ma'am. Thank you so much, ma'am.
Yeah, so before we start with your journey, I would like you to first introduce yourself.
Yes, ma'am. I am Dr. Venkatesh. I am from Bangalore Medical College. I joined DBMCI regular batch, ma'am, from last year, and I got a rank of 333 in this July session INI-CET.
Yes, so perfect. I think a very awesome rank in a very critical time, I must say. So,
Yes,
all praise for you. So, Venkatesh, first of all, tell me how did you manage? Because I think you will agree with me that this was not an easy time, and
yes, ma'am.
getting such a awesome rank in such a critical time when every odd was there, every odd.
Yes, ma'am.
So, how did you manage to keep up your pace and to come up with such an amazing score?
Yes, ma'am. Basically, I used to read the notes. I used to read the notes, ma'am, and after that, once it started, ma'am, the coaching, I used to read the notes and then follow the notes as the classes are being conducted. And I used to actually read very slowly, and I used to never revise after reading after one time. Like people used to say that you have to revise after the next class. You have to revise the previous day's class also. But I used to
Yes.
never get the time for that, ma'am. And
Okay.
but I used to read only once, and then I used to solve the MCQs then and there itself. And after that, ma'am, once the class tests got started, ma'am, and then I got to know that I'm very lacking at my concepts, and I used to score very badly at that time, ma'am. And then, but that used to demotivate me at that point of time, ma'am. But what I did was I used to find out where I'm getting mistakes, ma'am. Whether is it factual based or it is conceptual error that I'm making, and then I have to see where I'm going wrong, and then I have to correct myself in the and we used to get Sunday there used to be gap, ma'am. Usually in weekly once I used to get gap, and that day I used to cover myself where I'm going wrong. And then it went on till September end. Once it got over, and what I did was I read only once till the um, all the portion got over. And then after that we had the vibe session where we had all the image based questions and very images that were needed, and they were all discussed. And after that I managed to in the November session INI-CET, ma'am, I managed to cover like 12 subjects, ma'am. Only I didn't manage to cover all the 19 subjects, and I didn't expect a rank at that time, at that moment of time, ma'am. And in the November session INI-CET, I got 1084 rank, ma'am. But in the GTs, I used to get some 2000, 3000 rank, ma'am. But this November session INI-CET 1084 score actually boosted me that I'm not very far.
You can
I'm a
do
little
it.
closer. And
Uh-huh.
after that, ma'am, the NEET exam was on the January, but it got postponed, and that actually very slowed me
Become
down.
a boon for you.
Yes, yes, ma'am. And that actually initially slowed me down, ma'am. After that, I
Okay.
realized that I had not revised much, so this is a good time for me to revise that. And
Mhm.
then I started revising, and then again it got postponed to April. And
Yes.
and then actually initially I slowed down, but again I thought that it's a better time for me to revise as we had Rajat sir's motivation session and the Tamim sir's session, and then we
Mhm.
realized that. Whatever time gap we get, everything we should make use out of it. And
Mhm.
how much ever time we get, it's always less, and it's never be sufficient. And then I just made use of the time, and then I started revising. And after that I got to know that I had more factual errors than only conceptual errors. My concepts was pretty clear, ma'am, after in the April month. But my factual error was more. And then what I saw was the 20th book concept people used to say, and then I used to write all the factual things in one book, ma'am, and then I used to revise it more frequently towards the end of the exam, and again it got postponed after that April
Yes.
session, and then and then it was postponed indefinitely, and after that time also I was totally out of track, ma'am, and then it again the July session. June session INI-CET was again they gave the date, and again I started revising all the things, and mainly my main focus was on reading those factual things, man, because I was making more errors in the factual things more than the concept things. And after I was solving those previous year questions, and then I got to know that which concepts I was lacking, and then I covered concepts, ma'am. But mainly I focused on the factual things, ma'am, because I used to forget them very frequently. And then we had from June session only, from June only, sorry, from January we had this 10 GTs, wala, ma'am. 10 GTs we had, and that helped me a lot, ma'am, because I didn't know where I was going wrong. And then with each GTs, I learned that how to solve the questions, and we're all to actually concentrate in the questions, because they're so big questions, and I didn't know which line to focus more at. And I started again the skill of solving the questions better because of those 10 GTs now. And then and they give a very good explanation for that also, so that helped me get that extra content which I didn't have in my notes, and then I used to add as and when it's given, ma'am. And then after this June date, ma'am, again it was postponed after 1 month. And for that, ma'am, in the July session, ma'am, it was planned on 22. And for that I got a pretty good time, like 1 month. And for in this 1 month I revised more of like notes, ma'am. I used to flip the pages, and then used to read complete notes only, ma'am, rather than just concentrate on facts. And then my last week was more of question solving questions, and reading those factual things, ma'am, which I wrote separately in my book. That used to be my strategy, ma'am. That's all, ma'am. But
So,
actually, when it comes to strategy,
yes.
when it comes to
I
strategy,
think you are
ma'am.
a perfect example of certain dictums which we always say in the class. Number one is one size does not fit all.
Yes,
So,
ma'am.
yes,
That's
every time we say that, yes, you should read the notes, come after revising, otherwise, you will forget. But you did not do it, no problem. Second thing is slow and steady wins the race. So, you are a
yes, ma'am.
perfect example. You were slow, but you were steady. You kept on
Yes, ma'am.
studying, you kept on studying. Number three, one rank does not decide the destiny of any person. You saw 1084, you were getting 2000 or 3000. Another thing, GT ranks should not demotivate you. Means
Yes, ma'am.
if you are getting certain ranks in GTs, does not mean you will come out with the same kind of ranks in the final paper also.
Yes,
Use
ma'am.
it as a learning tool also, not just a testing tool. And the fifth is notes and notes. Keep on
Yes, notes, ma'am.
revising notes. That is the thing that we always say, that in the end just stick to your notes and you are there. So I think I don't have to pull these things from you. You have said everything from your means. People are listening from the horse's
Yes,
mouth himself, that one rank or one GT rank or one time if you are not able to do it does not mean anything. It is just that your destiny is taking you somewhere else. You have to keep on moving. This is not the time to
yes,
stop. And
yes, ma'am.
postponing obviously was discouraging for everybody. Like we were also discouraged, because after all now we are also committed to you people, so we were also
Yes, ma'am.
feeling demotivated. Now what to give, what to say, how to motivate the students. But means really commendable that you people were kept on motivating yourself also, and were able to do so. Very good. Any like you were constantly progressing, you were constantly
Yes,
working
ma'am.
on your weakness, but anything that you felt you could have done better, or anything that you have learned from your experience that you would like to share with your colleagues or the future NEET PG aspirants?
Yes, ma'am. Ma'am, once those 10 GTs they started, no, ma'am. Starting, I used to get very bad ranks, ma'am. Like it used to be about 1,000 only, and then I then what I focused was where I'm getting the mistakes. Whether it
Hmm.
is the way of solving MCQs, or whether it is the factual or conceptual memory. I divided the actually them into three things, ma'am. And
Hmm.
around 40 to 50% what I saw was, and I was making mistakes which already know the concepts, ma'am. The concepts which I already know, I was making mistakes at that point of at those topics, ma'am. And then I saw what I saw was I was not focusing that what except and uh, those the last lines I used to forget, ma'am. And I was not reading the questions properly, ma'am. I used to
Hmm.
forget when I read all the the questions used to be like from 5 6 lines, ma'am. When I read from 5 6 lines, I used to forget that the age factor, ma'am. And so that those were the silly mistakes that I used to do, and then I make sure that
If
I'm
you
not
remember,
doing that
I
the
always
next time,
say in
ma'am.
the
Because
classes when I
actually,
start the topic, ki please do remember these things, because in the end, the major things we always remember, but those small, tiny things we do forget.
yes, ma'am.
So that happens.
Yes, ma'am.
Yes.
Yes, ma'am.
And
When I
one
used to
thing more I
read
would
the
like
full
to
question.
tell, yes, one thing more I would like to tell to the students,
Mhm.
that so many students are actually getting, motivated with me, and they are taking ophthalmology. And I think Dr. Venkatesh is also one of them. And I really feel proud, privileged that, people are getting increased to my fraternity, and they are liking ophthalmology. Really, I'm privileged for that. Yes. So you were saying something.
Yes, ma'am. Yes, ma'am. Yes.
So
When you read those,
I
no,
really
ma'am.
feel privileged. Previously, only girls used to come and say, "Ma'am, we are also taking ophthalmology. After attending your class, we are getting an interest." But now I'm happy that even male fraternity is also coming, because I don't want
Yes, ma'am.
ophthalmology to become like obs and gynae, a female branch. It's a common branch, and both males and females can opt for it. Yes. So
My main thing was to consider ophthalmology was because it is more of an independent branch, and
yes, yes,
whatever pathology is there, I can definitely directly see with the naked eyes with all the instruments available, ma'am. So that
yes.
actually made me keep more interest towards ophthalmology,
I
ma'am.
think this is a very amazing thing about ophthalmology, that even if you see a dot, then that
Yes,
has a name, that has a diagnosis. Nothing is blind. Like in
yes, ma'am.
medicine, everything is blind. We do not know due to what fever is happening. So sometimes we are giving anti-malarial, sometimes we are giving ATT, then sometimes it becomes
Yes,
fever
ma'am.
of unknown origin. We have to treat it like that. But ophthalmology means diagnosis is there. And
Yes, ma'am.
everything has a sign and symptom. So it's very good that yes, people are appreciating that. And obviously it is very, very independent. We are not dependent upon radiologists, we are not dependent upon anesthetists. So
Yes, ma'am.
as a surgeon, you are not dependent upon other people to operate for your
Anyone,
cases. Yes. All right.
from they visit to us and till treating, if they are all with us only, ma'am.
Yes, yes, exactly. And so many other branches are dependent on us. Like whenever the medicine people are treating the diabetic people or hypertensive people, they have to send the patients for the fundus referral, or they have to request us to come there, because it is integrated with all the subjects. Now,
Yes, ma'am.
that
Yes,
is
ma'am.
why I have given the integrated lectures with almost
HS,
all the
ma'am.
subjects. So that is again a very beautiful point about ophthalmology, right?
Sometimes I used to sometime I used to see those integrated videos also, ma'am. That used to help me integrate the concepts, and usually the major concepts you had integrated with the other subjects, ma'am. So we used to focus on those concepts better, ma'am. Because you
Yes,
shared the images, and then you explained all those the various aspects of it, but like anatomy, radiology, ophthalmology,
yes.
images. So we used to better integrate those, ma'am. during the, like, we used to remember during the time of examination also, ma'am.
Yes,
Those things.
the main aim of those videos are so that you can remember it. Otherwise, you have studied those things separately in anatomy, in radiology, and ophthalmology. But when you see as a movie overall, then that helps
Yes,
you to
ma'am.
recall
Yes,
better.
ma'am.
Yes. Right. So
Yes.
I think our amazing journey from 1084 to triple three, Dr. Venkatesh, really commendable. Round of applause for you, and
Thank you, ma'am.
especially doing in this critical time. And wish you all the very best for the future
Yes,
endeavors
ma'am.
too.
Ma'am, I want to add a point, ma'am. Ma'am,
Yes.
from the beginning of my journey, actually, I used to think that I'm an average guy, and I didn't actually think of getting a good rank, ma'am. Actually, it is
Okay.
a, bad thing that we have the subconscious with us, that we are only the average people. We can't score better.
Uh,
Actually,
uh,
we have to remove that
uh,
subconscious mind belief that we can't achieve any great thing, ma'am. Actually, I got the subconscious to believe that we can achieve a great rank by actually correcting my mistakes, ma'am. The main thing which
yes.
boosted me my score was correcting the mistakes, ma'am. I used to
Yes.
find the where I'm getting mistakes, and then I used to find ways to solve them, ma'am. And that's how I
No, no,
my scores
exactly.
improved,
That
and
is why
then
we
I
always
started
laid the
believing that.
emphasis that you should always do the strength weakness analysis of your GTs. It's useful only when you are working on your mistakes. So that is pretty, straightforward. What you are saying, yes, you should always work on your mistakes, and that you have done, and you have seen the, result yourself,
Definitely,
right?
ma'am.
So, very good. And I think a very good point that you have said. I believe every person is capable. The thing is that when you start working on yourself, that decision that you have to do it and the focus. Only thing is that otherwise, every person is same. And if I, talk about the level, so every person who is doing the MBBS, I cannot, believe that he or she is not capable of doing the PG. Every person who is doing the mbps, I think it is being awarded as the hardest course
Yes,
in the world. So any person who is able to do that mbps is obviously capable of doing the PG. The thing is, you have to decide for yourself, you have to take that decision, and then start working hard. It is said that intelligence is only 1% and rest
yes,
99% is your hard work. So it is
yes, ma'am. Definitely, I
diligence.
believe in that, ma'am.
Yes. So diligence always, takes over intelligence, and that 1% intelligence has is present with everybody, with everybody. So
Yes,
I think, yes, a very good message that you have given. Please, don't discourage yourself. Don't have some prejudice about yourself. You can do it. You can do it. Start working hard from today, and keep your focus very
yes,
very centered. If you are distracted here and there, obviously, then that can create a problem. And thank you so much, Dr. Venkatesh. It was a very amazing and a good experience talking to you. And I hope all the other colleagues and your juniors who must be listening to your interview will also get motivated. Thank you so much.
okay, ma'am. Thank you, ma'am. Thank you so much, ma'am.